Good morning, everybody. I have the big opportunity to introduce our first speaker. He's a researcher based at the St. Louis University in the USA. He's specialized in prevention of sports-related injuries and their consequences. He's originally from Nigeria, living at the moment in the USA. And welcome to the stage, Olu Owoye.
Thank you. Can you hear me? All right, thank you so much. I would like to start by asking, which one is distilled, which one is sparkling? I want to take the distilled. I want to take some, which one should I take? Which is the normal water? This one? Okay, I got it. Okay. Yeah, we just take regular stuff in the US, and I'm not used to the sparkling water. Okay. Anyway, thank you so much for the introduction. Thank you to the committee for having me here. It's a pleasure to be here. My first time in Switzerland, and I'm liking what I see already. You know, I've gone around a little bit, not so much. I've barely scratched the surface, and it's a beautiful country, and it's very nice here in Bern, even though it's a little cold. So I'm originally from Nigeria. I'm a trained sports physical therapist. I had my BSc, my first degree, Bachelor of Physical Therapy in Nigeria, master's, and even my PhD in Nigeria. Then I moved up north to North America to do my postdoctoral fellowship at the Sports Injury Prevention Research Center. I'm trying to see if I can open this. Hope I don't need a special opener, because everything about Swiss is special. Okay. So I moved to the Sports Injury Prevention Research Center, University of Calgary in Canada, to do my postdoctoral fellowship for 4 years, and then moved down south and that was in injury epidemiology and some implementation science. Then I moved down south to the United States to start a faculty job as an assistant professor, and that's where I am right now at the St. Louis University in Missouri, United States. So today, just for you know, so I'm Nigerian Canadian and a permanent resident in the United States. So I'm all over the place. All right, so today we're going to be talking about sports injury prevention using the complex systems approach. So the complex systems approach is nothing new. It's just that I want to tell you guys about some pragmatic ways to approach it using some real-world experiences, all right? So hopefully today, by the end of this talk, you'll be able to recognize the role of a sports physical therapist in primary prevention, and then also in secondary prevention. Then we'll move on to discuss the multimodal approach to sports injury prevention, and then we'll finish by discussing the load management plus. And that's a framework we're using right now at the St. Louis University. Well, before I get started, I'd like to talk briefly about make some quick definitions. So there's this controversy about maybe we should be calling it sports injury prevention, or we probably just want to call it sports injury risk mitigation. Within the context of this presentation, I would like to clarify that I actually still going to stay with injury prevention because based on my public health experience and injury epidemiology background, I know that when you prevent injury at a global level, when you look at a cohort or population-based prevention, it's still prevention. And that's what we try to do in epidemiology. We want to prevent injury. So if I want to prevent injury in this room, it's okay to say injury prevention within the context of this room. But if I want to prevent injury in one individual, it's probably more likely referred to as injury risk mitigation because it's not 100% sure that you're going to prevent injury in that person. You just want to mitigate risk, and you may end up not preventing injury. So injury prevention, global. When you talk about injury risk mitigation, local. All right, so let's move on to the main thing. So how do we, what is the role of the PT in sports injury prevention? What is your role in injury risk mitigation? What do you need to do to move a little upstream in the upstream agenda of sports injury prevention? So let's have more definitions. So primary prevention, as you already probably know, you want to stop the injury from happening in the first place. We want to make people stay happy. You just want to keep things the same. So there's no problem, but you want to be sure everybody stays healthy. Now, going down a little bit, you talk about secondary prevention. That's more like you want to prevent the consequences or the early onset of a problem. So delaying it from happening. So delaying the early onset of the problem. So we talk about detecting it early, which is like, looking at the subclinical phase where you don't really see nothing. You don't see the symptoms. You don't see the signs. So you want to make sure that it doesn't progress to the real thing. And then we talk about arterial prevention, which is essentially what we do in physical therapy. We manage impairments. We treat patients. We fix ACL injuries. We fix ankle sprains. We treat stroke patients. But my own approach is, why not prevent the stroke from happening in the first place? Why not prevent the ACL injury from happening in the first place? All right. So the role of the PT in sports injury prevention is still really not really well explored. We're barely still staying within the realms of impairments. Helping people to improve quality of life. Treating impairments and doing stretching the hamstrings and the quadriceps muscle, treating acute injuries. So my challenge to you today, I'm hoping that today my talk will be a little, not just educational, maybe a little bit motivational and inspirational for you to have that call to challenge, to see how you can help your athletes improve or keep safe in sport, and not just wait for them to have that ACL injury. Okay, so essentially, the agenda is for us to move away from tertiary prevention to more of secondary prevention and primary prevention. And that is moving from the right to the left, which is more like going into be a little bit of data analytics, going into a little bit of, being like the facilitator. Essentially, in the role of primary prevention, you're more like, the facilitator. You're trying to see where the problem is likely to come from. You're looking at individuals and see how you want to have a bespoke intervention for people to say, okay, fine, we're having this general injury prevention protocol, neuromuscular training program and all that. But beyond that, at the elite level, the professional level, some folks will need additional interventions. And that is what you need to start thinking about here. So how do I facilitate injury prevention protocols? How do I get people to work with me? How do I get to form a model which we can use, to facilitate prevention and keep athletes safe in their sport? I like this quote by Desmond Tutu that says, we need to stop just pulling people out of the river. Some of us have to go upstream, to find out why they're falling in. So this is a very popular quote in public health. And I think you can use the same in sport physical therapy. We're so fixated on waiting for that ACL injury to happen. You know that the burden of ACL injuries and the likes of ankle sprain injuries and severity of the very severe ones is very high. In the United States, it costs about roughly $15,000 on average, $15,000 to have an ACL surgery, ACL reconstruction surgery. That's a lot of money. That's very expensive. So we can talk for the next 30 minutes about the consequences of these injuries. They're very concerning. We talk about post-traumatic osteoarthritis of the knee and ankle, after an acute incident of an ACL injury or a severe ankle sprain. So there's a reason for injury prevention. And I think the more PTs and physios that go upstream, the better for us. And so, like I mentioned, this can happen across the spectrum of physical therapy practice, but I think sport physio have a very huge role to play here. Now, let's discuss the basis for a multimodal approach for sports injury prevention, because when I talk about complexity here, there are different approaches to complex systems interventions. We talk about AI, we talk about machine learning. I'm just going to go pragmatic here. So let's see, what do I mean by pragmatism? We'll get to that shortly. Overall, let's just have a high-level 30-foot overview of injury risk in terms of muscle injuries. So we know that 1 in 3 athletes will have an injury through the course of a season. About 90% of these injuries is going to come from the lower extremities, and that's going to happen mostly, number one, culprit is going to be the hamstring injuries. We have quadriceps injuries, and we also have the abductor injuries, and then we talk about the calf injuries. So these are the top muscle injuries in the lower extremities. I have a little bias for sport, for soccer, because I'm more of a soccer and basketball injury prevention scientist. So bear with me if I refer to soccer a little bit or a lot more. So the risk of injury is very high. The risk of muscle injury is very, very obvious, and we need to do something about it. Now, the question is, how do these injuries happen? Because you can't fix a problem that you don't know. You don't understand a problem that you cannot fix it. And a problem that is half known is half solved. So we talk about how injuries happen within the little period now. So essentially, we talk about the mechanism of injury. So mechanism of injury, broad overview, contact, non-contact. I'm not going to spend a lot of time here because I want to get into the meat of it shortly, but I just want to give this background information so that we can be on the same page when I get to the practical interventions I'll be talking about shortly. So contact injuries, of course, happens when we also have non-contact injuries. But the good news is most of the injuries in sports are based on non-contact mechanism, and that infers that we can actually prevent. That means they're predictable. And if an injury is predictable, then you know that it's preventable. So we can have some interventions for that. And that's why neuromuscular training program is on top of the list for prevention, because neuromuscular training programs will help fix the neuromuscular deficits in athletes, when they're pivoting, when they're changing direction, when they're changing suddenly or decelerating. That's a function of neuromuscular training program. But I like to think about it further to say, okay, let's give everybody the vaccine of neuromuscular training program. What about at the individual level? What else can we do to keep them safe? And that's why the complex system approach is important. Can you help me press play for the first video so that you can just see the mechanism of injury for contact injury? I don't have a play button here. So the first picture, can you press play on it? I'm waiting for them in the technical room. Can you press play on the first picture? Can you press play? Oh, thank you. All right, so that's American football. That's a popular sport in the United States, and some of us watch American football, so you probably know what I'm saying. I know one of the speakers is a huge fan of American football. Shout out to Stephen. So this is what we call targeting using the crown of the helmet. Now, the reason why I'm showing this video is because, can you play the second one now? Is because not all injuries are going to respond to neuromuscular training programs. Some injuries will need to be fixed through, policy change. And some need to be fixed through neuromuscular training. Some needs to be fixed by basically just doing a focused strength training to improve the local tissue capacity. So I'm just trying to build this foundation of how to think of it from a very high level of how do we prevent injuries using so many interventions. Because the truth is, we need to stop thinking about just one risk factor leading to the outcome of injury, because that's not the case. It's a complex problem. And complex problems necessitate complex solutions. So in the first scenario, the person uses the crown of the helmet. It's forbidden to use the crown of the helmet to target your opponent. You're supposed to do a shoulder check-in. And if you use the crown of the helmet, you get ejected. And that's a huge fine to the team. So that's prevention at the policy level. That's part of the global vaccine I'm talking about. But the other one is non-contact. Perhaps if you do a baseline assessment and you do a weekly assessment on a retest to look at the local tissue capacity, do some ultrasound examination, maybe you start to see some pathological changes and you're like, okay, how do we help prevent a tendon rupture in this patient? So that's just the background for us to think about. Now, let's talk about injury etiology in terms of what we mean by linear thinking and non-linear thinking, which is a systems thinking approach. There's so many studies out there that shows us how we can actually model complexity. We shout out to Bittencourt and some other authors. And so you can read more about this. I don't have the time to talk about it, but essentially what I want to point out is this. Linear thinking will not work for complex problems. We need systems thinking for complex problems. And a complex systems approach is needed to best understand the injury mechanism in order to prefer intervention solution. So we need to start thinking about multiple interventions. We need to start thinking about, the elements of the system rather than the isolation of elements. We need to talk about integration of elements. We need to start thinking about offset and modification in terms of interactions between these elements and how that can actually lead to injuries. We need to stop thinking about, causation as association. Association as causation, because we know that association is not causation. The fact that you have a cat on a broken roof doesn't mean the cat caused the roof to break. Does everybody agree with me? So there's an association there. So the cat is sitting on the roof, and we might be forced to think maybe it's the cat that is bending the roof or causing the roof to be broken. But that's not the case. We know that there might be some other problems. It's very likely that the roof was hit by a wild wind, or maybe there was a car crash into the pillar that holds the roof. So this is just an analogy for us to start thinking broadly about injuries, the way they occur. The fact that you see something doesn't mean that something is causing the injury. So think complexity. Don't think about a linear movement, but think about the complex interwoven movement and interaction between elements. So how exactly do we prevent injuries? There's a lot of papers out there that you can read about. But all they're saying here is that there's so much injury prevention than neuromuscular training programs. I know Mario is a huge believer in 11 plus in the neuromuscular training program. Thank you for getting that going. And there's an extensive knowledge about the importance of neuromuscular training program. There's no doubt about that. But the truth is, neuromuscular training program is a global focus to injury prevention. There's much more that we can do. And the more we start thinking about that, the better for us. So essentially, the current knowledge tells us that injury prevention works, and in more ways than one. We also talk about performance enhancements. It's not just about injury. Even the so-called neuromuscular training programs can help optimize performance. So think about the perspective of performance, especially when you're approaching the coaches to create a model for individualized treatments or individualized prevention interventions for your athletes. Because coaches like to hear the word performance. We like to talk about prevention, but what do you want to hear more of is performance. How do you help me win the medal? How do you help me become the top 3 in the league at the end of the season? So if you can show them a little bit of that, that's a part of pragmatism that you have to start thinking about. If you can show them a little bit of that, then they're likely to comply and to buy into your prevention models. Neuromuscular training program is vital, like I mentioned, but a multimodal approach is essential. It's beyond that. So everybody seems to go the route of simple approach. Everybody wants to go the simple way, like, okay, measure ankle range of motion at baseline, and like, okay, whoever has a stiff ankle, maybe he's going to have an injury at the end of the day, so let me just mobilize the ankle a little more. I'm sorry, that might not work, because there's more to prevention than just mobilizing the ankle. So you have to think about so many things here, cause and effect. Now, let's talk about conceptual frameworks. Now, in the rich load management plus that I'll be talking about later, what we're using, and today I'm not here to give you theories. This is something I'm practicing right now at the St. Louis University, where I work. I don't work as a sports physical therapist, typical sports physical therapist. I work as a sports physical therapy scientist and data analytics, or data scientist. So essentially what I do is I just work with the coaches and give them feedback on a weekly basis to tell them how the athletes are doing based on the gadgets that we have. So we have a system in place. We have the catapult system. We have, so we have all that stuff, but they don't know what to do with it. So what I did was like, okay, I'm going to come in here and see what I can do. Okay, you guys don't want to pay a formal data scientist? You don't have to pay me, but I can give you some sports medicine analytics. That's what I call it. So I don't call it data science analytics. I call it sports medicine analytics, because that is more geared and tailored towards injury prevention and keeping athletes safe, But at the same time, I brought a little piece to it, which is the angle of performance enhancement, because that is actually what the coaches want to hear. So I'm doing injury prevention, modeling, and I'm also doing injury performance optimization on the other hand, because they want to see both work together. And the truth is, they're kind of intertwined. They're not explicitly separated. So they're very related. Injury prevention cannot be separated from performance enhancement. They work hand in hand. So in this concept, we basically just framing injury, the risk factors for injuries in 3 major variables. We talk about capacity, recovery, and load itself as a concept. So what do I mean by capacity? So capacity is anything that relates to the local tissue capacity, the athlete's tolerance for load, the athlete's level of aerobic conditioning, the athlete's readiness for performance, the athlete's, resilience and things like that, right from the global perspective to the local tissue capacity. And there's so many great measures for that. And today, I'm just going to be challenging you to start thinking about how you can form your own model, just using theories and basic concepts. Now, the other part of this component is the recovery variables. We talk about sleep management. We talk about things like that. So when you talk about recovery variables, you talk about soreness, you talk about pain, those things that come out at subclinical level, those things that come out so early for you to start knowing that maybe there's a problem going on somewhere. So think about the 2 group measures for recovery, okay? And all that is not going to happen except there's an exposure. So the big lion or the big elephant here is the sports load or the exposure itself. There is not going to be injury if there's no exposure. So load is a primary component in this model. And we know, based on Miwuse et al., and based on some other complex systems approaches, that injuries do not happen in isolation. Injury only happens when there's an interaction within the elements of this, what we call the determinants, the webs of determinants. Injuries happen when you have an interaction between intrinsic factors and extrinsic factors, in which load is a huge one. We talk about predisposed athletes and susceptible athletes. These components interacting with and inciting event, this guy right here, in a timely fashion. So what am I saying? There's never going to be an injury if there's no exposure. And these components have to interact in a timely fashion before there's an injury. So the guy that tore his calf muscle or his Achilles tendon, only tore his Achilles tendon because he had some pre-existing components of predisposition to injury. He had maybe a pathological tendon. He has some issues that we probably don't even know in terms of recovery issues. And he's probably been having some overload in terms of load exposure. And that happening when he was actually accelerating from and from a stable position. So it's trying to force an accelerated movement from a position. So the inciting motion now is the acceleration and the sudden change of direction. And then he tore his ankle, or sorry, he tore his Achilles tendon. So what am I saying? I'm saying that these things work together intricately, and it's really complex. So guess the only way you can prevent injuries. Can someone tell me the best way to prevent injuries while I grab some water here? Just be the #1 super fan. Don't do nothing. Just sit down and watch the sports. If you don't want to be injured, don't do sports. Yeah, I used to talk about prevention in my class too, because I coordinate one course in my work. I do a lot of research and I teach also a little bit. And I tell them the only way you can now have breast cancer is to remove the exposure. Let's get rid of the breast, all right? The only way you cannot, so I mean, inherently, we're all predisposed to breast cancer, especially higher in women because, it's a problem. The only way you don't have lung cancer is to reduce the load volume of smoke in your lungs. So reduce smoking or don't even smoke at all, You remove the exposure. The only way you don't get an injury is just to be the #1 super fan. But that's not going to happen because some people need to make money from sports. Some people need to, the health benefit of sports is so rich that we cannot afford not to move. I do my volleyball once in 2 weeks. I do my strength training, my push-ups in my office, in my room. We need to do sports. We need to exercise. So I cannot tell people not to move, not to do exercise. So the point is, how do we get them safe while they do all that? That's why we have to help them prevent injuries in sports. And now making a case for load management. So Katie is a student in she used to be a student in my lab. She's finished now. She's a doctor now. She has her PhD now. But she led a systematic review on cumulative load, association of cumulative load with injuries in youth sports. The reason why we use cumulative load here is because there's so much controversy around, is my time coming to an end? Okay, oh my God, I'm just getting started. All right, but basically the story here is that, yes, load is important, but it's not just about load, because we know that up to 40% association was not found in cumulative load and injury. So we're talking about a bidirectional relationship, a positive and negative relationship, but majority of the relationship, 80% of them is from positive relationship. So there's a relationship between load and injury. We talk about those response effects. But it's not just about the load. How do we use load to prevent injuries? Load management is really about tracking, evaluation, and intervention. It's not just about monitoring. When you monitor, what do you do with it? We talk about analytics and then the intervention that you give. Now, this is the second conceptual framework that we're using. And today, like I mentioned, I'm just trying to see if I can inspire someone to come up with an innovative model for your own practice. Maybe you're working with just one athlete. Get up a model and get something going for that athlete. Maybe you're working with a team. Start thinking about pragmatic measure. It doesn't have to be with catapult system or, Stata, whatever. There are so many systems out there. There's some other ways you can do this. So the second conceptual framework is that about everybody, because I work with team sport a lot, about everybody's going to have about equal, load exposure. Especially when you're good, you keep doing sport, your coach is not even going to let you rest. But we need to be sure that everybody's got the same capacity to know that everybody can actually play at that high level. So if someone doesn't have enough capacity, we need to see who's at the red zone, who's at the yellow zone. And that's when we talk about the local system for prevention, like talking about the second dose of vaccination beyond neuromuscular training programs. So you either can you help me click? You either just bring the load down. Can you click? Okay, they're not there. Okay. So I'm a very animated presenter. So you either click, I say, yeah, thank you, and they click again. So either you bring the load down, can you click again? Or you improve the recovery. So that's another conceptual framework we're using. We're just combining this concept. The truth is you can, it's always good to have a conceptual framework towards what you're doing. So this is the second concept. So now let's go to the meat of it. Like I talked about, the global and the focal intervention. The global is everybody gets it at the organizational level, team-based interventions. How about focal? We talk about sleep monitoring because you cannot intervene when you don't monitor. You need to know what's going on with each person, right? So you have to think about innovative ways to monitor sleep, monitor soreness, recovery surrogate measures. Think about capacity measurements. At baseline, you might want to do some strength testing to see the local capacity of that muscle. Do some ultrasonography to see the tissue, what's going on in the tissue. So you want to know whether something is not right. At the global level, all is good, everybody's good. Let's just give them a dose of vaccination just to keep everything good. At the focal level, not so good. Maybe something is going wrong somewhere. Let's find out where the problem is coming before it actually happens. And the last discussion point is about the load management plus. Again, I'm not here to tell you this is what you should do. No, I'm just inspiring someone today to think about upstream management of injury, which is prevention, and we're talking about primary and secondary prevention. So load management plus means load management and related interventions. When we talk about related interventions, we mean load, recovery, and capacity management. And this is just a high-level overview of what I mean by load recovery and capacity management. So load management involves risk communication. Essentially, you're monitoring. It's not just a baseline thing. It's an ongoing thing. At baseline, you want to find out a couple of things. You want to know who is at a higher risk of injury, who is falling within the 25th percentile, who is within the 10th percentile, who is not meeting up with the requirements for performance. So here, most of our athletes want them to be at least at the 50th percentile for strength testing. So at baseline, we do some strength testing to see who is not meeting the requirements. And then, you want to do a retest, maybe after 3 weeks or 4 weeks. And then you want to also monitor sleep on a weekly basis. So again, think about those surrogate measures. Get into the literature and see what other ways can I measure this recovery thing that Olu just talked about. What other ways can I measure capacity? And then think about the management protocols that is going to be appropriate for those measures. Sleep optimization, pain and soreness, and the rest of that. So it is all about the integration of evidence, innovation, pragmatism, and collaboration. That's what I call complex thinking, complex systems thinking. I don't use AI. It doesn't have to be complex before you actually make it complex and give some interventions that are pragmatic. So it's all about demystifying complexity and bringing it down into pragmatic measures and seeing how you can help your athletes. Again, build your own model and validate and continue to recreate. This is a typical example of what we're doing. And when we talk about pragmatism, you don't have to use a catapult system. You could use an app. So we have an app where we monitor for RPEs on a weekly basis for load. All right? So you don't have to use RPE. You don't have to use a catapult system. If you can afford that, maybe you can use an Excel spreadsheet. But you have to have research assistants working with you. So I don't do all these things. I just teach them what to do, and they report to me, and I do the analytics, and I send it to the coach every week. So think about how you can help your team get this going. And again, don't forget, performance is what the coach understands. They want to hear the performance aspect of it. An example here is a patient that is really doing growth so well, working at a very high load and at a very low exhaustion rate. That's what you want to see. And you tell the coach, this guy is doing well. And I can tell you, based on experience, this guy is one of the best players on the team, because he's working at a high load. I know that kind of contravenes the concept of prevention. But if a person is working at a high load, but his level of exertion is low, that's a good thing. So that means he's very fit. He's got a high capacity. Now, don't look for this on the internet or in the textbooks. So suboptimal cardiometabolic risk fitness is something I made up. You can't find it anywhere. So that's what I call innovation. But I need to make that up for the coach to know that we're doing something big, But I explain to them it's all about the readiness for the player, the capacity. So if a patient has, an individual has a suboptimal cardiometabolic fitness, then his heart rate exhaustion is very high, like this guy in B. This is not what we want to see. We don't want to see this. I don't want to see this happening. Very high level of exhaustion. It's just juxtaposing internal load with external load. This is very high level of exhaustion and with very low load. That's not what I want to see. I want to see high load and low rate of exhaustion. So that's more like what we want to see. And so take-home message, the principle is very, very, very straightforward. Not everything that matters can be measured, and not everything that is measured matters. Collaboration is vital. Pragmatism only happens when you're innovative. There are two words that work together. If you're not innovative, you cannot be pragmatic. Communication is key. On a weekly basis, like I mentioned, I communicate with the coach. You have to communicate. Sports medicine analytics is not a holy grail. You have to listen. You have to refer. You're just a facilitator, and not everything that can be measured, that is important, can be measured, and not everything that is measured is important. So please. Hopefully you've gotten some information from this, and you're probably going to be challenged to see how you can work with your athlete to get this going. And again, injury prevention at a global level and injury risk mitigation at the individual level is not complex. It's complex, yes, but it doesn't have to be complicated. Thank you, and I'm open to questions.
Thank you very much, Olu. Is there any questions? Please, hands up. Well.
So, waiting for any live question. I have one from the Slido. So, Olu, you spoke about the sports PT role. Do you think we can be global as a sports PT, or do we need an interdisciplinary team to achieve global management?
The second comment actually answers the question.
Yeah.
So it's interdisciplinary. It has to be a collaborative approach. You can't do it all by yourself. So when I talk about going upstream, I'm basically I'm talking about you being a lead, taking a lead in the process of injury risk mitigation and injury prevention when you talk about intervening at the team or the population level. So you're more like a facilitator, You're more like a sports medicine analyst, a data scientist in a way. You're looking on the back end and what you like the likelihood of something happening. You don't want it to happen. So you're basically just checking on the back end to see what's happening. And that implies that you have to look for ways of monitoring things, because if you don't see the problem, you don't know the problem, and you cannot fix a problem you don't know. So that means you have to look for pragmatic measures to see what might be going on the back end in terms of maybe this athlete is getting more predisposed to injury. Maybe this athlete is not working at a high level of performance. Maybe there's something going on with this person. Maybe he's overtraining. Maybe it's getting towards, moving beyond getting towards overtraining syndrome or things like that. So, but the only way you can know is to measure. And you have to be innovative about, and also be scientific about looking for pragmatic measures for innovation. Again, it's about facilitation. You're just taking a lead. If you see that there's a problem with sleep with a patient or an athlete, you refer to the expert. You don't have to be the expert. You don't have to do all the intervention. If a problem is within, maybe tending towards REDS, like relative energy deficiency syndrome, maybe a patient has some bone density mineralization problem, you might want to refer to the endocrinologist. You might want to refer to the dietitian. So it's all about facilitation, identifying the problem and sending to the right quarters. And then there's some things you have to do yourself. If you talk about focus strength training, if there's something wrong locally, then you can do that. But really, it's about doing a little bit and facilitating for others to fix.
Thank you so much.
You're welcome. All right, I think I can take my leave now.
Yes.
All right, thank you, guys.